So in this final video, I'm going to run through an example of the osteotomy examination from start to finish. So I'm going to put all those pieces together that we've seen in previous videos, and this is hopefully what your examination would look like. Hi there, my name is Lucy. I'm one of the nurse practitioners. I've come today to do some observations on you, which will include doing your blood pressure, your pulse, your respiratory rate and your temperature. Is that okay?
Sure.
Just before we start, can I just check your patient details, please? So your name, your address and your date of birth, please.
Yeah, name is Daniel White. My address is 2 Hill Close, St Austell, and date of birth is 28th June 1976. Excellent,
that's exactly what I've got here. So as I said, I'm going to do your observations if that's okay.
Sure.
I'm just going to wash my hands before we start. I'm going to start with taking your temperature, if that's okay with you. Do you wear any hearing aids at all? And do you have any ear pain or discharge in any of your ears?
No.
Have you got any preference to which ear?
No, that's fine.
Okay. I'm just going to take your temperature now. I'm just going to use your ear here. Just going to pop this one in your ear. Just going to hear a bit of beeping in a minute. Excellent, that's 36.8, so that's completely normal, which is good. I'm now going to take your pulse, if that's okay. So
sure.
Can I just use your wrist here? Can I just get you to pop it up on the table, if that's all right? Excellent, thanks ever so much. So I did your pulse then for a minute, which was 62 beats per minute, and nice and regular. And then I did your respiratory rates for a minute as well, and that was 12 breaths per minute. So again, perfectly within normal parameters. Dan, I'm just going to take your blood pressure now, if that's okay.
Sure.
I'm just going to give my equipment a little clean first. So I'm going to pop this cuff on your arm. I'm just going to pump it up a little bit, so it's just going to get a bit tight. Just temporarily. Do you have a preference with which arm we use? Any reason why we can't use one of the arms as well? Good, excellent. I'll just clean this cuff as well. Excellent. So I'm just going to have a check for your brachial artery, if that's all right.
Okay.
And just put that there now. So I'm just going to pop this cuff on your arm. I'm just going to check the sizing just to begin with. So just a couple of centimetres up in the anti-pupil fossa there. I'm just going to do this Velcro up. And I can see that the artery markers are there, so it's the right size for you, which is good. And I'm just going to place your hand up on the table, if that's okay. I'm just going to check your pulse a minute. I'm just going to pump the cuff up a bit tight just for a moment. All right.
Okay.
Just estimating your blood pressure here.
Sure.
Excellent. So I've estimated your systolic blood pressure is 130. All right. So I'm now going to just taking the air out of the cuff. I'm going to pump it up again there. I'm just going to use my stethoscope to take your actual blood pressure.
Okay.
So I'm going to pump up the cuff a little bit higher this time. So I'm going to go 20 millimetres of mercury above the 130, so up to 150. All right.
Okay.
So I'm just going to place this over your brachial artery. I'm just going to get a bit tight again for a second now. All right.
Sure.
So up to 150. I'm just going to release the air quite slowly now. Excellent. So I can hear that your blood pressure is 118/62, which is great because it's within normal parameters. There we go. So that concludes our observations today, and they were all absolutely fine. So thank you very much for your time.
Thank you.